Welcome back to my channel. My name is Medina and this is Queen Eats Nutrition, a platform created for people of color living with pre and type 2 diabetes that are looking to naturally balance your blood sugar, lower your A1C, and reduce the need for medication. And in this video, I got some goods for you. Now, I want to bring it back a little bit to when you first got diagnosed with diabetes and tell me if this sounds familiar. You go into the doctor's office, maybe annual checkup, something like that. Maybe you've been dealing with, X, Y, and Z symptoms, maybe not. But lo and behold, you find out you have diabetes. And the doctor's advice is, all right, hey, eat less, work out more, and take this pill and you'll be okay. And you're sitting there like, what? That advice is just not helpful. You need to be able to break this broad advice into baby steps or small actionable steps that you can start taking so you can start seeing improvement in your blood sugar. And that's where this video comes in. So I'm going to be sharing with you 3 things that you need to start doing immediately after a diabetes diagnosis. Here we go. Number 1 is start monitoring your blood sugar. I know that this part is really annoying, especially if you don't have a continuous glucose monitor that's just constantly on you. If you have to stick your finger every day, it gets annoying. However, you need to start monitoring your blood sugar so that you can see how your body is reacting to certain things and not just food. Because there are so many things that impact your blood sugar, like sleep and stress and sedentary lifestyle, if you're not monitoring it, you're just going to be playing this huge guessing game, and that is what's going to lead to frustration and overwhelm. Tracking your blood sugar is going to be so important because it is going to give you real-time data as far as what is working and what is not, especially as far as the food that you're eating. What does your body react to? How does it react to it? If you lose some sleep, how does your blood sugar respond to that? If you're in a state of stress, how does your blood sugar respond to that? This is why monitoring your blood sugar is so important because different things impact your blood sugar in different ways. Not only that, when you're monitoring your blood sugar and you're starting to introduce different lifestyle changes, seeing that number gradually improve is also going to keep you motivated to keep doing what you're doing. So it works on both ends of the spectrum. It can tell you what you're doing great at and what your body is liking, and it's also going to tell you what ain't cutting it and what you need to stop doing and the areas you need to improve in. Number 2, gradually improve your diet. Now, the key word here is gradually. Don't try to go from 0 to 100 overnight because that is not sustainable. And a lot of times when you try to bite off more than you can chew, you might be able to do that for a week or 2, but then you'll find yourself right back at square one because a lot of times when we're looking at changing our diet, the first thing we do is look at all the stuff that we can't eat or we shouldn't eat instead of taking a different perspective and starting by adding good things to what we're already eating. I'll talk about this in a future video as far as what to eat for balanced blood sugar, but for now, as you focus on gradually improving your diet, again, focus on what you can add to your plate instead of what you have to take away. Don't try to go from 0 to 100 overnight. When you think about what is healthy food, what comes to mind? A lot of people automatically think salads, and that might be a good start. But instead of saying, I'm going to eat a salad every single day because, let's face it, you're probably not going to do that. Maybe you can start by adding some fresh greens to breakfast, lunch, and dinner. Or maybe you can start by adding, a nice non-starchy veggie to every meal. Something like that. Tip number 3, start adding in at least 15 to 20 minutes of physical activity after your meals. Now, if you can't do this after every meal, at least try to do it after your largest meal of the day, which for a lot of people is dinner time. Don't just eat and then continue sitting down or go lay down and watch a movie or be on social media all night long. You want to move your body so that you can actually use the energy you just put in from food and burn it so you can keep your blood sugar at bay. Now, this physical activity can be anything. You don't necessarily need to go to the gym 3 times a day. It can be a 15-minute walk. It can be dancing around in your living room or chasing your kids around or something like that. As long as you are continuously moving for at least 15 to 20 minutes, you're going to be great. And again, this is going to give your body time to actually use the fuel that you just put in as energy. What happens when you just eat and then sit down is now you have all this energy that you've been putting in and it's just sitting there. So your blood sugar is going to spike. It's not going to come down anytime soon because you're in a state of insulin resistance. So you want to be able to help your body actually use it so that your blood sugar can stay balanced. Now, I have a signature course called Dominating Diabetes Academy, which is a self-paced online course that takes you step by step, week by week through the process of naturally balancing your blood sugar and lowering your A1C in as little as 10 weeks. You can find the link for more information about that in the description box below. And if you use the discount code, you might be able to save a little coin, okay? Thank you so much for watching. Let me know if this was helpful by clicking the thumbs up and subscribe if you haven't already done so. Leave a comment below if you have any additional questions or other topics in regards to blood sugar management or diabetes that you want me to cover, and I'll see you in the next video.